Hello and welcome to the Safety and Quality Education Program podcast. Developed by Metro North Health Safety and Quality in partnership with the Clinical Skills Development Service. Metro North Health acknowledges the traditional custodians of the land upon we live, work and walk, and pay our respects to elders past, present and emerging. The Safety and Quality Education Program has been designed with a focus on patient safety improvement. Each episode will explore ideas and stories in making our care delivery safer for our patients through the implementation of short notice accreditation. Our host is Dr. Mia McLanders, who is the Manager of Research at Clinical Skills Development Service. Mia is an applied researcher with a background in human factors and cognitive psychology. Joining Mia on this episode from Metro North Health is Grant Carriide and Dale Trevor. Grant Carriide is the Acting Executive Director of Clinical Governance, Safety, Quality and Risk. Grant has an extensive background in safety and quality, senior leadership roles, and is a lead assessor for the ACHS accreditation. Dave Trevor is a consumer representative on Metro North Standard 4, Medication Safety Committee. In December 2016, Dale received burns to 33% of his body and spent over a month at the Royal Brisbane, 10 of those days in induced coma. In this episode, our guests explore short notice accreditation and the benefits of going from a cyclic accreditation approach to a short notice accreditation assessment and what that change means in practice.
Grant, you said earlier that short notice accreditation has been around for about 5 years. So why are we implementing it now?
So probably around 15 years ago, health ministers across Australia came together and decided that it was really important that firstly we had standardisation of the ways in which we provide and measure the provision of healthcare across Australia, and that the goal would always be that it would be to evaluate business as usual, how we do it every day. And so the vision was always that we would have short notice assessment. In fact, in aged care, there is no notice. Assessors literally arrive on your doorstep, and perhaps we'll be ready for that one day in terms of healthcare that we provide apart from to older people. But at the moment, the vision of the health ministers of the time has been realised from the 1st of July. And it will be about what are our business as usual processes? How do we do this every day? Are we accreditation ready every day? Which means, are we providing the best care that we can to our patients every day? My career in health, accreditation has looked like that for a very long time, where we all got ready. We especially cleaned up the areas, and we put nice things on the walls, and we cleaned out the cupboards and did all of those things for that special day, the same as that teacher did to prepare for the school inspector.
What's the most creative hiding place you've seen or avoidance strategy?
Well, the best avoidance strategy I've ever seen is for people to take extended leave, but that won't be possible after the 1st of July because we won't know when people are coming, and they don't need to. I don't know that I've seen particularly creative hiding places. Assessors are nosy people by nature. I'm a nosy person by nature. If I see a cupboard that someone's standing in front of, I'm really likely to open it. There's no good hiding spot.
Sounds like a word of warning right there. So it is kind of daunting for a lot of people. Can you talk me through, though, the process of short notice accreditation and how you think, Dale, I'll start with you, how you think it actually directly improves patient outcomes and for themselves and for their families?
Well, we're moving it from, getting everything in order and looking good on the one day to business as usual. And that's what we want to know, whether everyday patient-centred care, people working as a team, doing the multidisciplinary approach, using all the latest techniques, using knowledge translation of all the best research outcomes, all of those sort of things coming in every day, and that we're working at going ahead in our learning, and we're working to improve things. I've got this theory: you're either going backwards. A lot of people think, oh, we're just staying still, but normally, if you're just staying still, you are going backwards. So we have to keep our head into what's coming, getting ready for it, learning as much as we can about it, upskilling ourselves, learning about the latest practice, and then seeing that translate into everything for good care and good patient flows, which is really important in hospitals at the moment, so that we are moving people along who are getting better soon and having support mechanisms so they can leave the hospital maybe a little bit earlier, so that someone sitting down at the ramp can move into those beds. So it's about efficiency as well. And that's what we do every day. It's not about just doing my job, this is my job, and it's in front of it. It's taking ownership for all of the problems across the entire system and doing what I can in my area to help the overall big picture.
You've identified to me before that you see accreditation as very much a way to identify where there are gaps in the system, where clinicians aren't being supported. How do you think, Grant, that short notice accreditation will help us identify those gaps in business as usual in our everyday practices?
I think just because it is about a measurement of business as usual, it's more real. And so the gaps are more likely to be identified because we will not have that notice. We won't have that dress rehearsal to get ready for it. We'll be able to understand where the systems are not supporting clinical staff and support staff in the ways that we want them to every day to provide the best care they can every day. I think that's probably the biggest advantage of short notice assessment. So the accreditation process, or the national standards, which are the things that are being evaluated by assessors, are about systems. They're not about individuals. And so they're very focused on the systems that we've got in place, and that's what they're assessing. And it's hard to attribute fault or responsibility to individuals when what's being assessed is the actual systems itself. So they're able to highlight the flaws or the imperfections in the systems that we've got in place, if we've got any. And there are many things that we are doing very, very well. And they're able to usually suggest to us ways that we might want to think about to do things differently so that we can improve the standard of the care that we actually provide to our patients. So not ever about identifying an individual or a group of individuals at fault. It's always about where is the system not working as well as we would want it to.
That's fantastic. And do you then think that there'll be an increase in the amount of quality improvement projects that we're seeing in clinical spaces?
We're already pretty blessed across Metro North, I have to say, in the wonderful ideas that people have and the wonderful ideas that consumers give us through their feedback about the ways that we can improve the services that we provide. Sometimes they are really simple things that we have not been able to see because we do it every day. But when a patient comes in and experiences that, they have an entirely different perspective on that because it's their single experience, perhaps, of that care that we provide. And then we go to the other end of the spectrum where we have got the most talented people working in Metro North who are just inspiring in the things that they are able to develop, the ideas that they are able to bring to fruition. And one of the great examples I've heard about recently is around the Hurston Biofabrication Institute, which has transformed patients' lives. I had the really rich experience, the great privilege recently of hearing from consumers whose lives had been transformed quite literally by the work that that institute does. And it's a world leader, and it's right here. It's not that far away from us physically right now.
A couple of things here. Just finishing off on the biofab thing, I know that they're, since I was burnt to 33% of my body. They've now got skin growing up there, and they now put a polyurethane matrix into the body and let tissue grow up to a plastic film. When it grows up to there, they peel that off and they put on grown skin to produce outstanding results on skin grafts that just haven't been there in the past because you've got a new layer of tissue to put it onto. But
Grant, short notice accreditation is quite new for us. Are you aware of any, other organisations that have been through it? What are the lessons learned from them?
So short notice accreditation's been an option available to organisations for around 5 years now. And a number of organisations, including across Queensland, have opted to undertake that option. And have all been incredibly enthusiastic about it. One of the frustrations that health service workers have voiced for a long time is that accreditation's not real, and that we fake it on the day. And so faking it's over when you have short notice accreditation. Organisations actually think it's easier, which has been a really interesting learning, I think, from the trials that were undertaken.
So we're getting about 24 hours notice, is that right?
Correct.
Yeah. Okay.
Yep. 24 business hours.
I see.
Yeah.
But they're finding it easier. Tell me more about that.
They're finding it easier because there's a lot of work that goes into preparing for accreditation. And because you don't really know what the assessors are going to be asking on the day, the paths that they're going to travel down, depending on the leads that they actually get. The old way was to prepare for absolutely every possibility, every eventuality. None of that's going to happen for short notice assessment. Short notice assessment is absolutely about, have we got the systems in place every single day to be able to understand the quality and the safety of the healthcare that we provide? Do we do the right thing every day, especially by our patients? And if that's not embedded every day, then we've got a challenge, but it is.
Mm-hmm. And what's happening behind the scenes at Metro North as this is going on?
It's the typical ducks on a pond, I think. There's lots of legs paddling very fast at the moment because we're really anxious to highlight Metro North in all of its deserved positive ways. We've got people who come to work every day committed to providing the very best care that they can to patients and to their families. And we want to be able to showcase that in a really positive way. And we're learning about how do you do that in short notice assessment. But basically it's about reassuring people that the care they provide is fantastic. It's about reassuring staff that assessors are sensible, pragmatic people who are experienced in healthcare, so they understand. They talk the language, because that's often really a big worry for people, and that they're not out to trip people up.
Is there anything that you can think of that might be of interest, or anything you want to add, Dale?
I like the idea that instead of this huge race into a big body of work, that we won't have the stress of that, but we'll have the lesser stress of not only keeping up to date, but it'll be easier to tweak it and keep it up to date. So instead of having this big body of work and then, let's relax a bit, no, we'll keep it up to date. That's an ongoing thing. And then that, when you've got those mountains that you used to have looming, we've got to get up to date on this. When they're all up to date and you're looking after those, I think that leaves you room then to be more proactive and say, what are the issues we need to look at to improve from here? And that's where you can go back to all sorts of data to look at to say, well, which one can we work on? Let's take a couple of these and really push them right through, so that we can see an ongoing change that will have exacting effect on our patients.
What effect has the no notice accreditation had on healthcare delivery within the aged care?
I think an overwhelmingly positive effect. All of us would be aware of organisations that have not passed and have been supported in most instances to lift the standard of care that they provide. I don't believe that most of those, or indeed any of them, have actually been aged care providers who are parts of government agencies. And I think that's a really important distinction to understand. But that process of no notice means that you are accreditation ready every day. And what that means is that you actually meet a required standard of care every day. You're doing the best that you can do.
Mm-hmm. Okay, and I think that's sort of one of the issues that I was thinking earlier when, as you were speaking, that knowledge translation, or that translation of what we learn through accreditation, actually does get implemented into change, and positive change for the clinical environment, but particularly for our healthcare workers.
It absolutely does. And there are a number of ways in which we receive the learnings from an assessment process. Assessors, as I said, are always from the health industry, and travel Australia and often internationally, so have incredibly good exposure to contemporary practice or really clever solutions to tricky problems. And they all want to share that information. So assessors are able to make what are formally referred to as suggestions for improvement. So organisations are not compelled to implement them, but would be wise always to consider them.
Makes sense, right? I mean, it sounds like a real rich database of knowledge and experience that they're bringing with them. So it's not about so much the assessment as it is about, bringing that knowledge and providing solutions or potential solutions for problems.
Absolutely, and I've had some great suggestions from assessors. I hope I've contributed some myself. But there is a more formal process by which assessors are able to make recommendations. Recommendations are not optional, and they work with organisations to develop recommendations that will be able to be applied within the organisation. So they'll be really sensible around the time frame for implementation, the capacity of the organisation to do that, whether it's appropriate to the size of the organisation. That one-size-fits-all approach just doesn't work in healthcare. And to do that really important consumer test about whether it's going to work for patients, will it actually improve the care that we provide or not? And so they're all really important considerations.
That's a fantastic point that you make, though, about the generalisability of solutions or recommendations to different clinical areas. It might have come from, say, for example, a tertiary facility, and you might be in a more rural area. How do you reconcile the appropriateness of those recommendations or suggestions for improvement?
If I were to consider that as an assessor, it's always about testing it with the organisation before I leave. And there's an opportunity after the assessment as well. So a draft is always sent to the organisation for its consideration, and the organisation will have had the opportunity to take a few deep breaths after that process is completed, and we'll have time to actually think about, will that recommendation work for us, or can we work with the assessor group through the lead assessor to just reframe that accreditation. So not changing the intent of it, but finding a way in which it will be practically implementable for the organisation and for it to actually benefit patient care.
And then, as you say, to have that consumer voice and
Absolutely
influence throughout that process as well. Super important.